All right, good evening, everybody. Welcome to the Medical Association's Facebook Live. My name is Aruna Arora. I'm the current president, and I'm here today with our state health officer, Scott Harris, and with our state ID expert, Dr. Michael Saag from UAB. And so we are here to talk to you before the holidays. We were hoping to not have to do something like this, but it feels very necessary to give information to you. So Dr. Harris, if you want to go ahead and give us an update.
Sure, I'll be glad to. Thanks very much, Dr. Arora, and thanks to everyone for joining us, and especially to you too, Dr. Saag. We're very glad to have you back and really looking forward to hearing from you tonight. We always appreciate this opportunity to speak directly to people and give people an opportunity to ask questions. And so just real quickly, the situation in the state is that we are a little concerned about how our numbers are trending. You know, we have had a couple of months of things being fairly quiet, but really for the past 2 to 3 weeks, it's been clear that our numbers are going the wrong direction, even though they maybe aren't progressing that rapidly. You know, the surge that we've had back in November and December a year ago, and then the surge that we saw in July and August this year were ones that really accelerated quickly. We saw a real steep incline in the number of cases. We're not seeing that steep incline yet, but there's no question that case numbers are going up. So we had been around 300 hospitalized patients on a given day for quite a period until the first part of December, when we saw that number increasing. Today we're right about 400 patients, and you know that's very manageable. You know, Alabama hospitals can handle those kind of numbers, but still a 25% increase over the past couple of weeks is a reason for concern. We aren't anywhere near the numbers of 2,500 or 3,000 inpatients like we've seen on occasion in the past, but we just have to wonder what the future holds. The news that everyone is hearing about, of course, is related to the Omicron variant. You know, it was really just the weekend after Thanksgiving when we first discovered that this was a variant circulating anywhere in the world, with the news that came out of South Africa. And in that time now, it's shown up in I think almost 90 countries around the world. It's shown up in about 46 or 47 states, and is undoubtedly in every state. Alabama had its first case that was identified last week, and yet the person who was identified as our first case is someone that had had symptoms since the very beginning of December. So there's no question that the virus had been circulating, you know, here in Alabama even before we detected it. So the real concerns about this is that it seems to be more infectious than the Delta variant. We'll look forward to hearing Dr. Saag expand on that. And it's certainly possible that our vaccine products and our monoclonal antibody products aren't quite as effective with this strain as they have been with the others. And that's definitely concerning. There's some speculation that maybe this variant doesn't cause quite as serious illness. I would say we don't know that for sure. But there are some anecdotes that suggest that that may be the case, and that's, I guess, good news if that turns out to be true. And yet, if you have a variant that's causing a lot more cases because it's a lot more infectious, you can see you can still get into a problem with a lot of people who are requiring care in the hospital or worse, if you have a whole lot of cases, even if the individual cases are less likely to be serious. So a lot of things happening. We continue to vaccinate people. Most of the cases in Alabama have been Delta until very recently. Our best data is that they are still Delta, although we suspect Omicron is cropping up now a lot more. For people who haven't gotten vaccinated yet, you absolutely should do that as soon as possible. For people who are vaccinated and eligible to be boosted, you absolutely need to get boosted as quickly as possible. Most of our shots over the past few weeks have been people coming back to get their booster doses. We've given about 500,000 third shots of vaccines so far. So that's a sort of a summary, Dr. Arora, of what's going on, and I'll be happy to answer any questions or anything else you all would like to talk about.
That sounds wonderful. Thank you. Dr. Saag, to you now.
Great. Thanks so much. Let me kind of break it down into the realm of what we know and what we don't know about Omicron, and then translate that into what we all should do. So what do we know? We know it's a new variant. We know that it's at least twice as transmissible as Delta. and Delta was very transmissible. We know that people who get Omicron, that it happens fast, that the spike of cases is almost like a rocket ship. So even though we don't have many cases now in Alabama, you're looking at other parts of the country and we're seeing that spike happen. I wouldn't be surprised if by the first of the year, the vast majority of cases here in Alabama might be Omicron. So we need to brace ourselves for that. We know that the vaccines work extremely well against Delta, but they don't work as well, as Dr. Harris said, for the Omicron variant. That is, if you've had 2 shots, there's about a 70% chance that you'd have a breakthrough infection. If you get a booster, that chance is reduced to about 30%. So the booster does seem to matter a lot. The neutralizing antibody that's produced by Pfizer and Moderna vaccines just don't have enough oomph with the original first 2 shots. So the boosters are really important in protecting against symptomatic infection. So far, what we know is that even if you've just had 2 shots, you're still pretty well protected against serious infection and death. Needs to be fully proven. With that booster, you get that added maximal protection, and that's really good news. The other thing we know is on the bad news front, the monoclonal antibodies that we've been using from Regeneron and from Lilly do not work against Omicron. That's a fact. So the bailout that we had been having for a lot of people, I think estimates are we prevented 70 to 85% of hospitalizations by giving those monoclonal antibody infusions within 5 days of onset of symptoms. We don't have those 2 antibodies. We do have something called Cetrovimab. Cetrovimab is a GSK product, and it does work. It's now being lined up for distribution to the state. Dr. Harris can tell us more about that. But that would be the monoclonal to use as we get more Omicron cases. We're hopeful that the supply will hold out, but we don't know that. But that is something. For the time being, though, we're in this really awkward window where we might not have as much access to Cetrovimab, but we won't have the Regeneron or Lilly product working very well. The final point is that we're waiting for other antivirals. The molnupiravir, which is the Merck product, doesn't quite work as well as we had once thought, so it's probably not going to be a tremendous help. It's going to maybe be on the market or available to us in the next couple of weeks. It's been approved by the FDA. The Pfizer protease inhibitor has not yet been approved in the US. It was just approved last week in Europe. It's a protease inhibitor, as I mentioned. It does have much better data. But again, both of those products need to be used very early in the course of infection. So that's kind of where we are. And I guess the final unknown Dr. Harris alluded to is that we really, while we do know this is much more transmissible, we don't know how much disease it's going to cause, particularly in the unvaccinated population. Delta, terrible in unvaccinated people. Omicron, we don't know yet. Early data suggest it might not be as aggressive in terms of symptoms and severe illness in unvaccinated people as Delta, but we don't know that yet. So if you are unvaccinated, please get vaccinated. It's not too late. Go ahead and start your series now, because there's a storm coming and we need to get in our safe place. And the safest place we can be is with vaccines.
I think that last point that you made, Dr. Saag, is to me like if there is a message that we could get out, that is the message. You know, this is the forewarning. Looking at the exponential curves, you know, in places that are ahead of us, looking at London, looking at different areas of our country. If we could get patients to take that first vaccine, that would be amazing, you know, and all the hesitancy that you may have had, just talk to anybody in the community who's been affected by this. You know, you don't want to lose a loved one, especially not right now during the holidays. And the unvaccinated are really the most vulnerable right now with this.
Right. And, you know, and I would like for the holiday season for us just to tap the brakes a little bit and rethink how we're all dealing with COVID. And if we can start to think of this just like we do weather, the weather folks come on TV and they tell us like it is in terms of a storm coming. That's what public health officials are doing. It's that simple. So we see this Omicron storm heading our way. We don't think it'll be as bad as the tornadoes that hit Kentucky and Maysfield and other places like that, but it's possible. So, like when you watch the local news and you see your weather folks telling you that there's a storm coming, especially if they give you a tornado warning, that's kind of where we are in public health right now. And think of this as a COVID warning or an Omicron warning. And the safe place for all of us isn't the basement or the interior rooms of the house. The safe place is getting vaccinated.
I think that's a really beautiful analogy. And I think it's important for all of us to remember that we are not divided between those who believe in the vaccines and those who do not. I think it's the compassion and the feeling that we really are looking out for our neighbors who aren't on board with these vaccines. And that is why this message is coming to you right now. We are nervous about the implications of what this means if you have not gotten your first shot. Because as Dr. Saag and Dr. Harris have pointed out, the booster, you could call it almost like your third vaccine that you need against the Omicron variant. I mean, it really is just the more protection in this situation, the better because of the evasion. Wouldn't you agree, Dr. Saag?
Yeah, absolutely. And let me just kind of pick up on your comment as well that, you know, as doctors and all of us in the clinic, seeing in the hospitals in particular in the ICUs, what we're seeing when we see people come in the hospital is 85 to 95% of them, depending on the time of when it happens, are unvaccinated people. The vaccinated people are not getting, they might get some a little bit sick, but they're typically not getting sick enough to go into the hospital. Similarly, among those people who die, it's 85 to 95% of the deaths are in unvaccinated people. And that really gets our attention because we're taking care of folks. We're trying to pull them through what turns out to be horrible illnesses. And then we cringe inside as providers because we know in our heart that had these folks who were taken care of been vaccinated, they wouldn't be in the situation they're in. And to our perspective, it's a preventable death.
Absolutely. And what you said is incredibly important. The fact that we don't have that monoclonal this time, it makes us all a little bit scared, you know, that if there are these patients who end up coming and we don't have something in a plethora to give to our patients, I mean, it's a horrific feeling to think about.
Yeah, it feels like we're on kind of like on a tightrope without as much of a net.
Absolutely.
And so we got to get through this.
Absolutely. So I guess any comments, you know, going into the holidays about testing, rapid testing. I've seen different regions of the country where they're running out of the Binex nows and the quick view testing at the pharmacies. I don't believe that's happening in our state right now, but can you speak to the matter of testing and how that can play a role, especially the difference between getting, you know, the rapid antigen test versus the PCR test?
Sure. So we are certainly encouraging people to get tested as much as they possibly can. We actually here in my house, we bought a few Binex Now tests when they were easily available. We've used them a time or two when we were going to get together with family. But I have older parents and I want to make sure that everything's okay, even though we're vaccinated and boosted and so are they. We want to make sure that everyone's as safe as we can possibly be. I think the strategy for moving forward for everyone is to be able to test regularly and test, particularly if you think you have some kind of symptoms. Test if you think you're going to be in a situation that might be high risk for other people, like a holiday gathering where people are indoors for a long period of time. Maybe mask wearing is not as easily done when you're eating and drinking. You know, maybe you have people traveling from many different parts of the country and you're not sure what the risk is. So testing is going to be really important. We have seen some sort of temporary, interruptions in those supplies. If you go and try to find tests, sometimes it can take a little bit of time to do that. We've spent a lot of time in discussion with our federal partners about that issue. The federal administration is committed to making tests available. They have contracts to purchase, millions of tests, and very soon, starting next month, insurance is going to reimburse everyone for the cost of a test if you have to buy one to do that. So there are some good things there, but it can still be a little bit of a challenge. And so I think if you have the opportunity to buy tests and have those available, I would encourage you to do that.
There was a question that came in about the accuracy of these tests for the new variant, the Omicron variant.
The PCR testing that is done in most cases is working very well. There are a handful of tests that are used around the country in different parts in kind of small numbers that may miss Omicron variant in some cases. The FDA has determined what those are, and that's based on the genetic targets that these tests use when they're trying to diagnose an infection. They know exactly what will work or what may not work in the case of Omicron. And so providers have been notified about that. There's particular things we can see on some of the platforms that are used that may miss one of the particular gene targets and give a clue that this could be an Omicron variant, and allow you to do some additional testing to confirm that. So the people who are doing testing have ways around that. Generally speaking, the over-the-counter test that you can buy, the antigen test, should work fine, and we don't have any major concerns about that. Generally speaking, PCR tests are a little better overall anyway, but there's no reason to worry about the test that you're buying over the counter.
That sounds good. Can we talk thank you for that description, Dr. Harris. Dr. Saag, can we talk a little bit about the difference in symptoms? There has been some discussion about, the Omicron variant perhaps being more of an upper respiratory cold-like symptoms versus Delta variant and the wild type. Can we talk a little bit about the symptomatology of these?
Yeah, sure. So the symptoms do seem to be a little bit different, although we're learning as we go. So I'd take what I'm about to say with a pretty large grain of salt, because as we learn more, it could change. But the Omicron variant does a lot of replication in the upper airway as it gets started. In fact, one study I saw last week showed there was 70-fold more viral replication with Omicron than with Delta in the upper airways. And so one of the thoughts is that there's more runny nose, more sore throat, scratchy throat early on. But the take-home point is not to get too nuanced at home. If you start getting symptoms of a cold, if you start feeling kind of crummy with symptoms of a cold, that's the time to get tested immediately. Because if you get caught early with COVID, with Omicron or otherwise, that's the time to call your provider and try to get monoclonal antibody if you're eligible. That means somebody who's older, somebody who's got underlying health conditions. That's why it's so important. So I wouldn't get too cute with trying to say, well, this feels like Delta, this feels like Omicron. But when you get those symptoms, get tested right away. One thing I forgot to mention that's, I think, very important. Earlier in December, another monoclonal called Evishield, which is a product that's made by AstraZeneca, was approved for something called pre-exposure prophylaxis. So what's happening with the Regeneron and the GSK and Lilly products, we give it after symptoms have developed. This is done for people who have health conditions where their immune system just is not going to respond well to a vaccine. So that could be people on certain types of chemotherapy like rituximab, or on immunotherapy where the doctor and the patient is concerned. You can give this monoclonal through an IM injection. It lasts up to 6 months and it works against Omicron. So it's another one of the monoclonals that actually will still work. So if you're in a position right now where you know that your immune system isn't quite up to snuff. And maybe even if you've had 3 shots, you still may benefit from getting this pre-exposure prophylaxis as the Omicron strain is headed our way. So talk to your doc, especially the one who's prescribing the chemotherapy or the immunotherapy for you. They'll know. I don't know if that drug is available right now. It was just approved earlier in the month, but that's one that you should look for to protect, give you additional protection if you're worried that the vaccines may not have worked as well with you because of that condition.
I think that's an excellent point to touch on. So yeah, if you have a rheumatologist or an oncologist, this is something to definitely stay ahead of, as it is pre-exposure. So that is something to file away for sure. I think that's really helpful. Dr. Harris, there was a question that came about if you were to go to the pharmacy and you see, the slew of different tests out there, are there certain tests that you would recommend? And, some people are confused because, the question has come up, is it true that the more expensive test is more reliable, or is there no such correlation between price and reliability?
There's really not a big distinction to make, in most cases. That the Abbott test and the Quidel test have probably been used the most. They've been produced in largest numbers, but there are, there are many others actually that have equally received, emergency use authorization by FDA. They, except for a handful of tests that we know about, I mentioned, that may have some questions with relating to the diagnosis of Omicron, and which aren't sold over the counter anyway. There's really no reason to make a distinction. So I don't know that price is really a proxy for quality here. I think you just find a test that's available to you, and that's the one that you should get.
I think that sounds reasonable. So I know nobody likes to hear this discussion about the non-pharmaceutical interventions, but I was recently at my children's choir concert last week, and I've had 3 vaccines, but I still wore my mask, and it was a very large gathering. And so can we discuss how we are to navigate this highly contagious variant right now in our communities as we are Christmas shopping and indoors? Can either of you comment on masking and the quality of masking, perhaps between wild type and something that appears to be more contagious?
I'll start, and I'd love to hear Dr. Saag's thoughts on this as well. But none of these interventions are magic. Vaccines aren't magic, but vaccines work really well. In fact, they're the most effective tool that we have. Masks aren't magic, but masks are very effective and they work. So is washing your hands, so is keeping your distance, so is trying to avoid large gatherings. These are all just tools in the toolbox, and each one gives you a different layer of protection, another layer of protection. And when we see these numbers going up right now, like we're seeing them around the country, it just makes sense to use all the tools in your toolbox to try to protect yourself.
I agree. I don't think it's either or. I think it's and. So my recommendation is, if at all possible, for the next 4 weeks, avoid very large crowds, especially if those crowds are indoors. Whenever you're out, I really recommend wearing a mask, especially when you go indoors. So that could be the grocery store, that could be going to a children's school event, keeping social distance. By the way, the masks that work best are the K95s or the N95s. A lot of people may not have access to that. Surgical masks are good. Cloth masks, not as good unless you really have them tightly fitting on your face. And the sort of bandana type masks don't work that well at all. But so wearing a mask, keeping distance, washing hands, as Dr. Harris said. And then for a lot of us, and I hate to be Ebenezer Scrooge again this year, but I would just take a pause and think about, if I'm planning on traveling, is this an essential trip? I know we all want to be with family, especially when we have loved ones that are older and live kind of far away, and we really want to make sure we touch base. But maybe that could be postponed until after this Omicron wave has passed. Not saying you should cancel. I'm just saying just rethink it. From my perspective, if your plans are taking you overseas in the next 4 weeks, I would strongly rethink that. Not only because of potentially picking up Omicron or some other variant overseas. It's really that you put yourself at risk of potentially getting sick while you're overseas and having to get health care there, which may not be as easy as you might think. And then navigating your way back, especially if you've been sick, you're going to have to wait a while. That's something you probably didn't plan for. So I don't think it's a great time right now to do international travel with this explosive Omicron around. Again, everyone makes their own decision. I just think it's worth rethinking and asking, is this something I can put off a little bit more?
I think that is really, really wise advice because nobody prepares for those, A, B, C, what happens. And so if you are going somewhere, there's a possibility you may not be returning right away, depending on how that scenario pans out. So,
And the irony here is that I'm the type of guy who normally says, for me, plan B is for plan A to work. And that doesn't work so well in this situation.
yeah. Okay, we have another question about, can you talk about the state's positivity rate? How much is it growing and why should we be watching it?
Sure. Our percent of tests that return to us that are positive is a measure that we followed really since the very beginning, because it just gives you an idea of the number of cases that you're seeing out there, how many people are going and requesting a test and getting that test and having those results come back positive. We've had some times during the really worst days of the pandemic so far where more than 20%, more than 1 in 5 of every test that's done return as positive. In recent weeks, we've been down below the 5% positivity range. We've been actually gotten below 4% briefly, and those are not as good as they could be, but certainly better than we've been. In places like New York City, for example, they have used a 3% positivity rate related to school openings, and at least this past year that was their cutoff. So you get an idea that low as possible is what you want. But over the past 2 to 3 weeks, we've seen our percent positivity creep up. Now it's over 7%, around 7 or 7.5%. There's a lot of reasons that absolute number may not be completely accurate, because there's a lot of testing going on that we don't really have visibility on. People are testing at home. Those results don't always get tested to us. So our percent positivity is just based on PCR results that are in laboratories that do report to us. So, but even if that absolute number may not be, completely accurate, I think the trend matters a lot. I mean, I think that whether that percent positivity is going up or going down, and the speed with which it changes is really important. And so right now it's been increasing at a pretty good clip, and that's worrisome for us. And that, confirms what we're seeing with our hospitalizations going up and with our daily case numbers creeping up as well.
Yeah. So along the lines of a more contagious variant and the percent positivity going up, as we just discussed, and predicting something that could overwhelm our hospital systems here in the next few weeks. Any comment to schools returning? Is there any sort of discussion on forward thinking on how schools should return with masks? Any thoughts on things like that, Dr. Harris?
Yeah, I would say our advice hasn't changed. It's become really clear in the past couple of years that those decisions are, made with a lot of different factors, including political factors that don't have anything to do with what our scientific recommendations are. But our recommendations haven't changed. We believe universal masking in schools is the right way to go. I mean, we have, particular reasons that we've all lived through the past 2 years about why we want kids to be in school in person, if there's any way we can possibly do that. Sometimes you can't, but in most cases, we hope that we can do that. We've made allowance for the facts that sometimes kids have to be seated more closely together than we would, ideally like. And that just has to do with the physical size of classrooms and the number of kids that are in there. We understand all those things that need to be considered, and we're really trying to bend over backwards to keep kids in school. We're trying to get them vaccinated. we're trying to do all those things, and masking, which, you know, for some unbelievable reason has become the most controversial aspect of what we do in schools. Don't know how we got here. But masking makes a lot of sense when you're putting a lot of people in a small space close together. Vaccination is not as good as we like, and in some age groups, not even possible yet. So our advice hasn't changed at all. You know, that policy, the governor said that falls to local school boards, but we're going to continue to recommend it.
You know, and there were data that came out back in September or October, looking at opening of schools in and around Phoenix, Arizona, Puma County, Maricopa County. There were about 2,000 school system or schools that opened up. Roughly half of them had a mandate right up front, and another half didn't. And the number of schools that had to subsequently shut down temporarily because of an outbreak, it was 8% or 8 out of the 8% out of the group that had masking up front, and 59% of schools that did not have a mask mandate up front had to shut down for a while. So to the point that masks work, they do. It's really a prudent thing from a public health perspective to implement, especially as a wave of new infections is coming to us that's very highly transmissible. Everything Dr. Harris said is, of course, at play, because we're not isolating just to public health issues. But if we're thinking, in my opinion, first about the safety and the ability to keep schools open, I would suspend, in my opinion, or my recommendation, some of those other factors and focus on the public health. And at least when we go back to school in the first part of January, it seems to be wise with this Omicron wave almost certainly hitting us by then to have a mask ordinance in place, at least until we get to February.
I could not agree more. And, you know, I have 2 vaccinated children, but they've been wearing their masks throughout school. I mean, I wouldn't say they're in the majority, but they have been wearing their masks. And I hope schools can do some forward thinking when we have a contagious variant going forward. I've spoken with Don Williamson, of course, with the Hospital Association. And, you know, it's not just going to impact our COVID situation, you know, what's coming with Omicron, but we have, you know, difficulty with nursing shortages and you know, we're 2 years into this pandemic, and taking care of non-COVID patients and the surge, you know, again, this is winter time. We're going to see flu. It's really just an important message to share right now that we all need to be part of this, you know, to keep this from really being a potential disaster in front of our eyes.
And we're all tired, right?
Yeah.
Everybody's tired. I mean,
Everybody's
different
tired.
walks of life, right? And we're
Yes.
3 of us are pretty tired. Everybody listening is tired.
Yeah.
Hospital workers, etc. But the enemy here is the virus, and it's not quite to the same degree as, say, the bombing of London in the early 1940s, but it really does take similar perseverance to weather this out. And again, it's not anybody's fault that these variants are happening and that they're going to probably continue for a little bit longer. But it is up to us and how we approach it and what type of attitude we take. And so despite the fact that we're tired, we can't change the fact that the Omicron variant is coming and we're going to have to deal with it. So try to find the reserve to get through it in a smart and in a smart way that keeps us all as safe as possible.
I think to hear you as a virologist, you know, studying viruses for your whole life, say that these variants are not our fault is something that deeply resonates, because, you know, there's just so much finger pointing out there in this world right now. And I mean, we're really just trying to get through it and, you know, help everyone get the information that they need. And there's never a point where it's too late. If you were not believing in these vaccines and now all of a sudden you want to go and get your first shot, you know, there is no problem with that, you know, so we are always here to just provide that kind of information. And so if people can go get their first vaccine, if they can get their boosters, if they've had their first 2 vaccines, and if they can be cautious in these large gatherings, as you both discussed, with the quality of masks and just wearing a mask if they were to go to the grocery store, These are the types of things that will protect each other in our communities, our neighborhoods, keep our hospitals afloat. Any last comments, Dr. Saag, Dr. Harris?
Well, I'll start, give Dr. Harris the last word. We do see this storm coming. The good news underneath all of this is that we know a lot about this virus and these variants now. It's not a total surprise. We know what to expect, and we have tools that we didn't have until about a year ago in terms of the vaccine, the knowledge of mask work, the other things that we can do. So now's the time just to implement it despite our COVID fatigue, and try to just to weather this storm out and get through to the other side as safely as we can.
Thank you. That was great. And I'll just add to that. If you're still not sure about what you ought to do with regards to vaccination, if you're not sure what you ought to do with your child with regards to vaccination, please just talk to your doctor. You don't have to take it from me. You don't have to get it from social media somewhere or from your friend who's not medically trained. Just call the person that knows you and your family and who takes care of you and provides health care to you, and ask them what you ought to do. And I think that's the best way to get the information you need.
I think that is a wonderful note to end on. Absolutely. The person that you trust with all the issues, once you shut that door and you have that patient-doctor relationship, please trust your doctor and ask them these questions. Well, I appreciate both of your time. I hope everybody has a really wonderful holiday season ahead here, and just be safe. We really are worried for everybody, and we want everyone to be as safe as they can for themselves and their families. Thank you. Merry Christmas, everybody.
Merry Christmas to you all, and Happy New Year.
Happy New Year.